Did you know 1 in 5 women will experience some sort of mental health issue either during pregnancy or right after childbirth? Expecting mothers and new mothers are going to want to tune into this episode because we have reproductive psychiatrist Dr. Sarah Oreck here to give you the tools and tips you need to know to stay mentally well during this incredible life-changing process.
Your brain, your body, your mind, your soul. The What's Working Show with Kelly and Kyle.
Dr. Sarah Oreck is one of very few psychiatrists who specializes in reproductive mental health. She joins us today to debunk mental health and wellness myths around pregnancy and new motherhood and sheds light on what to do instead. When it comes to mothers who are either expecting a baby or maybe they just became a new mother, what are some of the common mental health issues that they're facing?
Yeah, so there's a lot of issues with mood and sometimes anxiety, but what's really important is that sometimes these symptoms can overlap with some physical symptoms of pregnancy, but it's really important to talk to your providers to make sure you figure out what's what. Because often some mental health symptoms can be sort of brushed under the table as physical symptoms. But in fact, you are really fatigued from pregnancy, but if you're so fatigued to the point where you're not getting out of bed, something else might be going on.
So you're saying don't blame everything on the pregnancy.
Exactly.
Okay, so when can we blame stuff on the pregnancy?
Well, certainly there's some parts of pregnancy that make you fatigued, or you can't concentrate as well, and you're also carrying a human being, your body's changing. So certainly there's some things that we can blame on the pregnancy itself, but I think when it starts to really interfere with functioning, with your sense of happiness or being excited about the pregnancy. Now, you don't always have to be so excited about the pregnancy. It's a time of huge change. You can be really scared, but as long as there's a combination of feelings.
Yeah, that's good that you just gave everyone permission to be scared.
Yes.
Because they think, and of course I'm speaking in general here, but a lot of my friends who are parents or mothers think that they have to always be happy about this birth, that they can't show any signs of scared or I don't know what to do, not only because they're a mother, but because everyone else will judge them if they don't.
Right. But what the reality, it's a huge transition, right? And it's okay to feel a mixture of feelings like we do in every transition in our life.
A lot of our viewers are mothers. How did you feel when you were carrying your first child? Were you like, I'm gonna nail this? I got this in the bag? Or were you thinking, oh gosh, what am I gonna do in 9 months? I'd love to know your comments below. Okay, if we have those symptoms, expecting mother has those symptoms, and she decides to ignore them and not seek out treatment, what are some of the consequences of that?
So some of the huge concerns are sort of falling back on, I think, some negative coping mechanisms or ones that aren't so adaptive. So things like drinking alcohol or smoking marijuana are things that we really shouldn't be doing during pregnancy. And so that's like a huge concern. Also of having depression or sort of worsening mood symptoms. And then of course, this is something that's not talked about so much and the research is fairly new, but there are effects on the fetus if we don't treat our anxiety and depression. Some of those can be like low birth weight when they're born or even an early delivery, which can be kind of scary.
Can you treat depression using just medication while you're pregnant?
You can.
Okay.
It's a very complex issue. It requires a consultation with someone who knows about this because medications, of course, have risks, but untreated depression has risks as well.
Right. So you have, as a mother, you have to go, do I treat my anxiety and depression because I don't want the consequences of not doing that to affect me and my unborn child?
Exactly.
Or do I not take these meds and I go struggle with my depression and anxiety because I don't want the meds to affect my child?
Right. But then if you decide that you don't want to go with medications because of fears of, whatever it is,
right.
Fears of any issues that might happen if you take them to your unborn baby, what scares me and I think is really important to discuss with moms is if you're suffering through your pregnancy, that sets you up for most likely to have a difficult time during the postpartum period. And here you're not just caring for yourself anymore, you're caring for a baby.
Yeah, especially especially first-time parents, they have nothing else to compare this to. So they might just think, oh, this is how it is. You're depressed, your anxiety's through the roof, you have no idea what's going on, and you don't get help. That's just what motherhood is. And you're saying it does not have to be that way.
Not at all, right? We have this sense that motherhood is being a martyr. We're not caring for ourselves anymore, but it's not.
Right.
And I think it's also important to normalize that some of those feelings are okay, as long as you're still able to find joy in parts of motherhood, as long as you're still able to function and do the things that you want to do.
Yes. Now, in the second half of this episode, we are going to talk about a ton of solution-based strategies that expecting and new mothers can do. But I want you to mention briefly for our viewers that some of the cognitive distortions that you're seeing a lot of moms have.
Yeah, so let's start with what cognitive distortions are. And so these are some thoughts that people with a lot of anxiety or some depression might have. That's a way of like thinking about the world in a negative lens. I like to say you have your anxiety goggles on or you have your depression goggles on, and you see everything through that lens. And so that usually has a sort of bad connotation, like, oh, I can't be a mother, or I ate a candy bar, so I'm going to be a terrible mom. I'm just going to feed my kids candy all day. When like one meal or one sort of cheat does not make you a bad mother, nor will it sort of change the outcome of your birth or of how you raise your child. So I think it's trying to sort of, and part of this can be kind of being able to talk to people around you so they can sort of reason with you about what's going on. But cognitive distortions are so common, and it's important to sort of try to figure out what's going on there and where those thoughts are coming from.
My friends who are currently pregnant, I reached out to them when I knew we were going to do this interview, and some of them said, what would Dr. Oreck advise for an expecting mother who's having the thoughts, I'm going to be terrible at this. I'm not going to love this baby enough. This baby's not going to love me. I'm going to repeat the same mistakes that my parents made with me. So
the last one I think really resonates with me, because I think a lot of times, especially new parents, a lot gets activated from when they were children. And it's a time to sort of relive that relationship from like a different perspective. So I think it's a really interesting time to examine some of the issues. But if stuff comes up for you, if you have trauma, it's important to seek treatment for that so you can become aware of some of those patterns and not repeat them. And then in addition to some of those distortions of you're not going to be a good mother, you don't know yet, right? And part of that is us being panicked or scared, and so those where those feelings come from. But I think as long as you're able to see and sort of reason at some point, well, I don't know yet. Let me have the opportunity to try. And as long as it's sort of you're still in the game and you're still willing to care for your baby, then it's not something that I'm too concerned about.
Got it. Okay. Understanding the possible problems is of course important, but Dr. Oreck is going to share the solutions when we come back from this inside look on her series on perinatal anxiety.
I think there's a lack of recognition that this is different from other types of depression and anxiety. And so the push now, and what's been wonderful in California, for example, now you're required to screen a woman for depression or anxiety at least once during the pregnancy. But they don't clarify with what tool.
Right.
Or how.
It could just say, are you depressed or anxious?
Exactly.
And they say nope, and they get a check mark, and they're never asked about it again.
Exactly.
Yeah.
And so when you're asking those questions, that's not really getting to it, right? And a lot of women feel like frightened that if they say yes, does that mean they're going to take my baby away, or I'm not a fit mother?
Right.
And we really need to clarify that that's not what we're trying to do here.
Yeah.
That it's not a punishment. It's to try to see how we can be helpful.
You can watch that series and more when you visit medcircle.com. Dr. Oreck, let's focus on some solutions and best practices for these expecting mothers.
Yeah, so one of the first things is when you first find out you're pregnant, don't be surprised if sheer joy is not the only or first emotion you feel.
Good. What are some emotions that are common?
So I think people commonly think that only women who have unplanned pregnancies feel a complete state of panic or anxiety. But truthfully, women that have been in IVF treatments, that have been wanting to become pregnant, when they see that they're pregnant for the first time, panic might be the first symptom or the first sort of emotion. And that's okay, because guess what? Your life is going to change so radically, right? Your social life, your career, your finances, your body. And I think it's really important to sort of feel okay with that, and because you're going to feel a mix of emotions. And that doesn't mean that you're not ready for it or that you're not going to be good at it.
Right. That's important for women to know. There's so much pressure placed on expecting mothers. Dads kind of get this pass, I feel like. Oh, you're going to be a dad. Good job, buddy. Well, with mothers, it is like pressure's on, 1,000 questions. It's a lot.
And I think we're moving in the right direction. In some social media, I've seen more realistic portrayals of what's happening, but we still see a lot of sort of the bliss of pregnancy or the bliss of motherhood when the reality is so much more complicated.
Absolutely. What else?
I think a big one is take some control or all control of your OBGYN appointment. And actually, I should correct myself because there's family physicians, midwives that deliver babies, so whoever is going to deliver your baby. Too often I notice that women sort of don't speak up, don't have their their questions answered because they're intimidated by the white coat or the speed at which their provider is going. It's important to say, hey, slow down. I need to ask you these questions. I like the tip of having the questions and maybe asking before you're on the exam table and sort of in a vulnerable position, because that can often be really hard as you're getting a pelvic exam to ask all the questions you have. Sort of better to have eye contact. And if you feel like it's really hard for you to do, then whoever you've brought to the appointment, ask them to speak up. And I think if you're really not being acknowledged, or if you feel like your questions or concerns aren't being answered, find someone else.
Yeah, absolutely. We forget that those people work for us.
They're your employee.
Yeah, you can get fired, you can get hired, I can give you more money. I mean, this is, you work for us, right? And people need to we talk about that in mental health all the time. If you don't like your therapist, get a new therapist.
And to feel empowered to do so.
Yes.
Right, I also think it's really valuable to work through things, especially if there's some interpersonal things that can be worked on. But if a provider's like, listen, I've got no time for you, and is just totally shutting you down and dismissing you, I mean, that's not a relationship you want to be in. And I say that because then when the labor comes and the delivery comes, if there's an emergency and if you don't have good rapport with that person, you are not going to trust the decisions that they're going to make.
Yes, in our series, you said something, rapport is core.
Yes, rapport is core.
Rapport is core, so look for that rapport. All right, let's go on to another tip.
So when you start telling people you're pregnant or you appear to be pregnant, you are going to get a lot of unsolicited advice from everyone.
Yes.
So be prepared for it. I like to tell women to have an answer to some things that are coming up, but it's really important to sort of take what you like, leave what you don't like. I think we've all been a parent or a child, and so we think we're experts in that relationship, but it's really important to remember that they're an expert in their experience. Like, you're an expert in your body, in your own experience. The sort of cases that I hear a lot about is, a patient of mine is 38 weeks pregnant. She's ready to deliver with her first child, and her sister decides to tell her all about her emergency C-section.
Oh, thanks.
Right, and I think it's important to just say, hey, I'm really stressed out about this happening. Can we talk about this at some other time? Or validate their experience. That sounds really scary. Can we just sort of put a pin on it? And then when I have my delivery, we can talk about it more and we can share our stories. So just really have an answer, because it can be a really challenging time, and everyone has something to say about being pregnant.
Yes, while you're saying that, I'm reflecting on how I treated my sister-in-law when she was pregnant with my amazing nephew, Stone. But one thing, I was watching Grey's Anatomy, and there was this terrible childbirth on the episode, and I knew she watched Grey's Anatomy, so I text her, I go, do not watch Grey's Anatomy. And now when you're saying that, I go, maybe that was unsolicited advice. Like, maybe she's allowed to choose whatever show she wants to watch, you know? But
Not so medically accurate generally, but.
That's true. But I thought you were going to say touching of the belly.
Oh, that's a really challenging one.
Why do people think that's okay?
I don't know. I think having an answer prepared, like no touching or something like that, can be helpful. I've also heard an anecdote of someone sort of putting their hand on the person's belly who wasn't pregnant to show them how inappropriate that is. And I think that's a nice way to sort of send the message. It's like, when I touch you and you don't ask me to, it's weird.
More people ask if they can pet Callie when we're out than if they ask my sister-in-law, can I touch her belly? That's wrong, right? What do you think? Leave a comment below. I want to know the opinion. If you agree with me on that, give this video a thumbs up. Okay, what's another tip?
I think going on this one, sort of stop seeking out unsolicited advice on Google.
Yeah.
So a lot of people are looking on message boards and things that just aren't vetted, and it's really important to note that, of course, it's great that the internet has so many communities for people that are suffering, but it often tends to be sort of a negative bias. And so if you really want medical information, please go to your providers and ask for reputable websites or for their advice on books or what to read.
Yeah. I mean, that's literally why MedCircle produces this show, produces many other shows, and produces the educational series, because you can't go to Dr. Google.
Exactly.
You're just going to freak yourself out. Yeah.
You will find anything, right?
Of course. Yeah. If you look for it, you'll find it. Good advice. All right. What else?
Another one is that you're going to get a lot of rules about what you can eat, what you can't drink. I like to sort of flip that, where people can feel like focused on what they can do. So there's not this feeling of deprivation, because this can be really challenging for women that have had issues with eating disorders. And of course, there's a lot of anxiety around the weight gain that does happen during pregnancy. And that's really triggering for women with issues with body image and eating disorders. And I like to really reframe it and say, well, let's think about the reason that the weight gain is happening. And when you think about housing and nourishing and supporting your baby, it's a lot easier for women to feel comfortable with that weight gain, you know, and not being able to see their toes when they know, oh, well, you know what, I'm supporting the life of my new baby.
Absolutely.
So another tip is if you do have issues with being weighed, and that's been an issue for you in the past, and sort of numbers on the scale are something that's sort of uncomfortable, you can ask to turn around while they weigh you, because weighing is part of the pregnancy sort of health care routine, and just ask your provider to let you know if you're gaining weight at a healthy rate.
Yeah, that's perfect. Okay, some food and alcohol questions for you. Can you eat sushi when you're pregnant?
You know, here we say not to, because we just don't know sometimes the source of the fish, and just to be really extra cautious.
What do you mean here?
Well, in the United States.
Okay, got it.
I think in places like Japan, I'm not sure what they do, but I imagine that they might eat more. I'm not sure.
Right, okay. Can I have a glass of wine every now and then? If I'm a pregnant woman?
I see that in Europe all the time. Like, women are just drinking alcohol, but we really don't know how much is a safe amount or dangerous. We know that there's a lot of issues with alcohol. Fetal alcohol syndrome is just one example, but sort of really bad outcomes, and we just don't know how little or how much is dangerous.
Okay, that's fair. Now, what about caffeine?
Caffeine is a tricky one. Again, we want to reduce everything sort of that could be, I think, negative or deleterious to the baby, but I think a lot of women have a huge dependence on caffeine. And if it sort of means reducing to maybe 1 cup of coffee, if that just is part of your morning routine and you have to have it, I think it's okay. But again, there's risk to everything you put in your body. I think it's important to not get too rigid about it, because then you fall into some challenging patterns where if you deviate from that just slightly, you really beat yourself up, a lot of negative distortions. And so I think it's important to be flexible, right? If there's accidentally a soft cheese mixed into a salad and you had no idea and you ate it, like, your baby's gonna survive and you're gonna be okay.
Yes, yes. 80% of new mothers experience something called the baby blues within the first 2 weeks of having this new baby. I would love for you to talk about how mothers can expect that almost, and some wellness tips that they can use to make sure that they're moving through that stage as healthy as possible.
Absolutely. So the baby blues really describes a time 2 days to about 2 weeks after you have your baby, and it's a time of a lot of emotional lability. So you're really sort of emotional, mood swings, some tearfulness. Some women describe it as the worst PMS of their life, and it's because the progesterone and estrogen that was stable during pregnancy just quickly drops off when you deliver your baby. And so we think some women are really sensitive to those changes in hormones. Now, it's really important for people around you to know what's happening. And I think as long as that's the case, I hope that people can get through that if they know what to expect and know that doesn't mean that you're mentally ill.
Yeah. I think that's really critical. I don't know if a lot of expecting mothers anticipate that.
and some people don't have it. But you should expect to have maybe a little bit of tearfulness or just some emotional changes in those 2 weeks, and know that that goes away. It's not dangerous, and it's something that you can definitely get through with support.
So once the baby comes, what should new moms know?
So I think it's really important to line up supports before, and hopefully you know who's going to help at night, if your partner's going to be involved in feeding. I'm hoping that if you do, you get some time off for maternity leave, and maybe your partner does as well. But if not, figuring out what the childcare is going to look like so you can have some relief once in a while, because it can't be a full-time job or you'll burn out.
How do you expect a single mother on her third child she works 2 jobs? She goes help at night?
Yeah.
No, I don't have money for that.
I know. I'm hoping family can be really helpful, but in general in the United States, that is a problem that we face as a society. In places like France, the childcare is subsidized, right? In Sweden, you have over a year of maternity and paternity leave paid. So we just don't have those resources, but I'm hopeful that that person can find someone to maybe hire a nanny with someone else, or someone in their community that can be helpful. In some communities, they actually share the responsibility with other parents, right? If you're having a hard time, I can take care of your kids tonight, or if you need to work tonight, I'll take care of the kids and we'll trade off. So there's ways to form community, but it's really important to find those resources.
Yeah, and the big piece of advice I don't want us to just skim over is doing this before the baby shows up. Just anticipate it. You're gonna want the support, so figure it out and get it lined
Yeah, and
up.
I don't want to scare people. You know, some people, it's really easy. They have other kids. It's sort of not as hard. But I think it's important to sort of prepare. And then if things would go great, awesome.
Yeah.
But be prepared for some challenges.
Yeah. Now, a lot of my new mom friends out there, they go, "Oh, sorry, baby brain." What are they talking about?
So I think they're referring to a fogginess that sometimes happens after delivery. There's some difficulty with like word finding, or just not being able to remember that restaurant you went to a couple months ago.
This sounds like me all the time. I was born with baby brain. apparently.
But there's no scientific evidence that you become less smart after giving birth. And what actually we think is happening, and some research is coming out about this, is that social parts of, or more empathic parts of our brain are actually developing, so that we can understand the cues our babies are giving us that are more nonverbal. So their cries, their facial expressions. So in a sense, women might be losing, you know, what restaurant or what actress was on that show they watched last night, but they're getting smarter about nonverbal communication.
It's like they're evolving into like a better human being.
Or a different human being.
Yeah, different. Wow, that's incredible. So that reminds me of my sister-in-law, Kelsey. I'm bringing you up a lot on this show, girl, but she suffered from migraines a ton. Had a baby. Migraines pretty much have disappeared. Wow. Is this something that women experience after having a baby?
You know, every woman is different. That's a wonderful story. I haven't seen that many cases of that, but that's fantastic. And for some women, I have to be really clear, pregnancy can be a wonderful time, right? For some women who have mood or anxiety disorders, they feel really stable during pregnancy. But it's really important to figure out, to know that there are some women that don't.
Yeah.
And for those women to not get lost in that.
Yeah. A really scary thing that I've heard from a lot of my friends who have had babies is that when I held my baby, I didn't feel in love, or like my life finally had purpose. I just felt like there's this baby in my arms.
And I think that's perfectly normal, right? It's not always love at first sight. It might have not been with your romantic partner. So why should you expect it with this person you don't know, right?
That's a good point.
And I mean, think about birth. Like, you might not be able to feel half of your body, right? You might be on pain medications. You might be sedated. This baby is bloody, maybe crying. It's a really difficult and challenging situation. And so sort of being okay with the fact that it's going to be a lot of different feelings. I like to call it the ambivalence of motherhood, right? You are losing your independence. You have this big responsibility now, and that's okay, right? You could be, and I think the joy will come eventually, and the attachment will come eventually, but you're just meeting this person.
Yeah.
Right? They don't really have a personality. They're really needy in the first couple months.
Yeah.
And some women don't feel that strong attachment for a couple of weeks.
Yeah. Wow.
Or when their baby's finally able to smile at them.
So what if this is going on 6 months in?
Yeah, so if it's 6 months in and your baby's more active and despite being engaged, you feel really like detached from the baby, that's a red flag for me in terms of possible mood symptoms or anxiety that's going on, right? There's something that's not allowing you to really connect with this baby.
Yeah, and so what do they do?
So seek treatment and seek help. Talk to your partner about it. It's really important. If you have a comparison of what things were like with your last child, that can sometimes be good, but definitely bringing that up because that's something that is a little bit concerning, and right? And you want to have the best time with the baby, and babies are purposefully really cute, or else they wouldn't survive.
Absolutely. Perinatal Anxiety, the series at medcircle.com featuring Dr. Oreck is available. We have a great session in that series all about treatment options, from therapies to medications, the do's and don'ts, what you need to know, what questions to ask. It's all there. You can access that series at medcircle.com. Dr. Oreck, as a reproductive psychiatrist, I mean, this is it for you. Like, this is what you do.
Yes.
What are your final words and thoughts that you want all expecting and new mothers to know?
That motherhood is really difficult, and it's a transition, like we talked about matrescence,
Yes,
like
explain that.
adolescence.
Yeah.
So it's a term that was coined by an anthropologist in the 70s, but it's slowly been coming back into vogue because it describes perfectly the fact that this is a huge transition. For some women, the biggest transition they've ever had.
Yes.
Right? Their hormones are completely different, their body has changed, and their life has changed, right? Their role has changed. And so I think we are pretty clear about how awkward teenagers can be, how moody they can be, and we sort of accept that that's a developmental stage. But I think it's really important to shed a light that becoming a mother is another developmental stage, and it comes in all sorts of different emotions, with mixed emotions, and it's not just sheer bliss and happiness.
Yes, amen to that. You're so wonderful. I love it. Thank you for being here, and thank you for shooting the Med Circle series and coming on What's Working. It is such great and insightful advice. Mothers out there, man, you guys are the heroes. I'm telling you. Good job, and thank you for tuning into this episode. If you've not yet subscribed and liked this video, please do. If not for me, for the sleeping beauty right here, Callie. Who wagged her tail, now she's waking up. Thanks for watching. I'm Kyle Kittleson, and remember, whatever you're going through, you got this.